So as we get older, what tends to happen is that the fat pads in the cheek areas tend to slide inwards and downwards, creating nose to mouth lines, and later on what we call marionette lines, the lines that go down the sides of the mouth. And then again, most people tend to get a kind of a slackening in the jawline, or jowls as some people call them. So one of the ways of addressing this is to try and put a bit of volume back into the mid-face and a little bit of lift. So it helps to lift out the nose to mouth lines, lift out the marionettes, and just make the face look naturally a bit softer. Mid-face fillers are quite long lasting, which is good. So you're looking at around 18 months. With fillers, if you're injecting parts of the face that don't move very much, it will hold longer, and when you're injecting quite deeply, which you are with mid-face fillers, then again it will hold longer. So by contrast, if you're injecting into the lips, for example, that's one of the areas that tends to wear fillers down much more quickly, partly because we're moving the mouth, constantly. Again, it's just about being moderate, I think, in your application of fillers. It's much easier to inject small amounts, review after a few weeks, or even a couple of months, and then inject a little bit more. And I think going softly is really much more the way that most people want to do it these days. In terms of contraindications, there's a few. They're the usual ones. Obviously, if you've got someone who's got a known allergy to a filler or any of its ingredients, fillers and Botox not recommended, are advisable during pregnancy or breastfeeding, in the same way that no drugs on the market really are recommended or advisable during pregnancy or breastfeeding. So again, with fillers, there's not a lot of do's and don'ts. When you're treating the mid-face, in an ideal world, it's good if the client can sleep on their back that night. It's not very easily achieved. I normally just say try and fall asleep on your back, and if you wake up, turn yourself over onto your back. So there's always a possibility of bruising, so it's always a good idea to schedule treatments like fillers and Botox for when you've got a few days where there's nothing important happening in your life. So there's lots of different fillers on the market. As I said, I use Juvederm, which is a hyaluronic acid based filler. One of the advantages of those fillers is that yes, we can dissolve these treatments. However, it is a bit of an unknown science, and it's really something that we tend to reserve for when we have to dissolve, when there's a problem. Well, I think clients should be looking for evidence that the person that they're seeing is firstly qualified, and that might be being registered with an official governing body of some description. They may well want to see before and after pictures of previous procedures. They may want to ask the practitioner about number of procedures that they undertake. I think it would be important to ask about what to expect in the follow-up period, because for me, again, I think it's essential that you offer some kind of contact in the follow-ups. It's not just about the pre-treatment assessment and the procedure itself, but about what that client does if they're worrying at home about something, or if they're not entirely happy. So just making sure that whoever you're seeing is going to be with you for the whole journey and not just the first bit.